review, it was commissioned by Hammersmith and Fulham Council, actually, when it was opposing the closures, and Ealing Council. It was done by an independent auditor, Tim Rideout, and it talked about how it needed to be upfront that one of the main points of this was financial savings. And it also talked about the fact that there was not conclusive evidence that the plans would deliver the kind of savings that they said. That's the first thing. Secondly, when there was an independent reconfiguration panel, there was a lot of evidence that went into that, and even though the Conservative government didn't want to back down and keep Charing Cross open, they themselves said there needs to be more work done because there's not enough evidence that your plans for the community will actually hold together. And the final thing, I hope I'm not abusing the chair, I'm just trying to give people facts, is that there has been much controversy recently about how community care funding will be followed on, which is a critical part of, if you want to close A&E beds, you'd have to know that the community can cope. And because in Hammersmith and Fulham, Kensington, Chelsea and Westminster, the budgets are going to be merged with social service, even Sir Bruce Keogh, the medical director, raised concerns about whether that money would be siphoned off for other staff, and therefore whether actually community care services would be able to deliver what they need to do. So I think it's important people get on with those facts. But on to members of the public. Jen.